Today, we're going deep inside something that might seem pretty routine, an antenatal examination. But what if I told you that this simple checkup is actually one of the most powerful life-saving tools we have in medicine? Let's find out how.
So that's the big question, right? How exactly does a series of simple checks and measurements become a life or death intervention? What are clinicians really looking for? And more importantly, how do they connect all the dots to protect both a mother and her baby? To get to the bottom of this, we're not going to just stick to theory. No, we're going to follow the real story of Mrs. R. She is 23 years old, 28 weeks pregnant, and by walking through her checkups step by step, we're going to see exactly how this whole process works in the real world. All right, so here she is, Mrs. R. She's 23, it's her second pregnancy, and she's from a rural village. But look closer at her history. Her first pregnancy, she had no antenatal care at all, and her baby was born at just 2.4 kilograms. That's a low birth weight. You know, that one detail right there already tells us we need to pay very close attention.
Okay, so every exam starts with just a look, a general assessment. Now, this isn't just a casual glance. It's a trained eye scanning for subtle clues about the mother's overall health. And right off the bat, we find some really important clues. The clinician notes pallor, which is a clinical way of saying she looks pale, a classic sign of anemia. There's also some mild swelling in her feet, or pedal edema, and her weight gain so far, only 4 kilos at 28 weeks. That's a little concerning. These are the first pieces of the puzzle. Now, for a single number that tells a massive story. The clinician takes out a simple measuring tape and wraps it around Mrs. R's mid-upper arm, the mid-upper arm circumference, or MUAC. And the result? 22 centimeters. So why does that number matter so much? Well, it's simple. Anything less than 23 centimeters is a huge red flag for maternal undernutrition. At 22 centimeters, Mrs. R just isn't getting the nutrients she needs for her own body, let alone to grow a healthy baby. This is a really serious finding. All right, let's move on to the vitals. Pulse, temperature, they're all checked. But during pregnancy, there's one number that every doctor and nurse watches like a hawk, and that's the blood pressure. And there it is, 138/90. Now, the cutoff for normal is 140/90, so she is literally right on the edge. This is definitely elevated, and it's a big warning sign for something called gestational hypertension, a condition that can get dangerous fast if you're not watching it closely. So we've looked at Mrs. R's overall health. Now it's time to focus specifically on the pregnancy itself. This is the hands-on part, where the clinician can figure out so much about the baby's growth and position using nothing more than their own 2 hands. And they do this using a classic technique called Leopold's maneuvers. It's really clever. The fundal grip feels for what's at the top of the uterus. Is it the head or the butt? The lateral grip finds the baby's back on one side and its little arms and legs on the other. Pollock's grip checks what part is down low, ready to come out. And the pelvic grip sees how far down the baby has settled. It's like creating a mental map of the baby. Another key measurement is the fundal height, basically how big the uterus is, and it grows in a really predictable way. You can see here by 28 weeks where Mrs. R is, the top of the uterus should be about halfway between her belly button and her breastbone. And here's what they find. Her fundal height is measuring around 26 to 27 weeks. So a little smaller than expected for 28 weeks, but still very close. But here's the great news. The baby's heart rate is a nice, strong 144 beats per minute. Perfect. It tells us that despite all the issues with mom, the baby, for now, is doing okay. Okay, so we've collected a ton of data, right? We have observations, we have vitals, we have measurements, we have a hands-on exam. But this next step is the most important one of all. It's time to connect all those dots and build the full clinical picture. And when you put it all together, wow, the picture becomes crystal clear. The pallor and our blood test confirm she has moderate anemia. The 138/90 blood pressure points to suspected gestational hypertension. That 22-centimeter arm measurement confirms she is undernourished. And you absolutely cannot forget her history. It's not just one thing, it's a whole cluster of risks building up. Now, in India, they have this fantastic system called PMSMA that uses simple color coding to manage this. If everything's fine, you get a green sticker. But for Mrs. R, because of this combination of risk factors, she's immediately identified as a high-risk pregnancy. She gets a red sticker on our card, a simple
powerful, visual signal to every single person who sees her that she needs special attention. So identifying the problems is one thing, but now you have to ask, okay, so what are we going to do about it? This is where the clinician creates a clear, actionable plan, all based on national guidelines to tackle every single one of Mrs. R's issues. First up, the anemia. The anemia-free India guidelines are super specific. You can see right here, her hemoglobin level puts her squarely in that mild to moderate category. So the protocol is straightforward. Her dose of iron and folic acid is doubled, 2 tablets a day instead of 1. Simple as that. Next, that blood pressure. The plan here is all about vigilance. She'll get her BP checked every single week. They'll check her urine for protein, which can be a sign that things are getting worse. And maybe most importantly, she gets counseled on the danger signs. She has to know that a bad headache or blurry vision isn't just something to push through. It's a signal to get help immediately. Now, Mrs. R's personal care plan is powerful, but here's a really important thing to remember. It's not happening in a vacuum. She is being supported by a massive public health system designed specifically for mothers just like her. I mean, just look at this safety net. You've got programs that give cash for hospital births, programs that make delivery and medicine totally free, the PMSMA program that flagged her as high risk in the first place, and a whole national mission dedicated to nutrition. It's an entire ecosystem of support. So how do all these big national programs actually reach one woman in one small village? Well, that's where the real magic is. It's the community health worker, known as an ASHA. She's the one who will visit Mrs. Ra at home, make sure she's actually taking her 2 iron tablets, and gently remind her of those danger signs. She is the vital link that makes the whole system work. And that brings us to maybe the most critical takeaway of all. The entire system is built to catch problems early, and that includes empowering the family itself. Everyone should know these danger signs: any bleeding, a severe headache, a fever, or if the baby stops moving. Knowing when to ask for help is every bit as important as the medical care itself. In the end, Mrs. R's routine checkup uncovered multiple serious risks and kicked off a plan that could very well save her life and her baby's life. Her story is a perfect example of a system working exactly as it should, which leaves us with one final, huge question to think about. What will it take to make sure that every single expectant mother, no matter where she lives, gets the same level of incredible life-saving care?